And now, Pathway to College and Careers from Minnesota, Julie Nigan and Michelle Pefferon.
Close. Good afternoon. Thank you for the opportunity to present here this afternoon with this prestigious group. Talking about our program, we've spent a lot of time over the last several months talking about this program, so we're happy to do it at this level. So more than 400 immigrants, refugees, and undereducated adults have entered Pathways to College and Careers, our Bridges to Healthcare program. It's an individualized, systematic program. Pathways to Prosperity is a unique partnership between Hawthorne Adult Basic Education System, Rochester Community and Technical College, our Workforce Center system, and our employer partner, Mayo Clinic. It provides an opportunity for clear pathways to self-sufficiency for participants who are currently being served by public assistance in some form or another. And it helps give them access to education to provide them the opportunity to be self-sufficient. So this afternoon, we've decided to share with you 4 stories to really highlight how the program works and the clients that we're serving.
Had Pathways existed, Amber's story and the stories of many other adult learners would have had vastly different endings. At 16, Amber left South Carolina and arrived at Hawthorne with her 2-year-old son. She had not attended school since she was 12. She and her son entered our family literacy program where he began preschool, and she attended parenting and high school diploma classes. At times during her 3 years with us, Amber was homeless and lived with a Hawthorne teacher and her family. When she completed her high school diploma, Amber entered Rochester Community and Technical College. Her Hawthorne teacher accompanied her to orientation and registration to ease Amber's transition to college. We all breathed a sigh of relief and satisfaction, prematurely. Within the first 2 weeks of the semester, Amber missed a couple of days because her car wouldn't start. She had no idea how to access the support she needed and dropped out of college. We didn't find out about her barriers and about the unfortunate results until months later. Too late to help. This was the impetus for Hawthorne to expand its mindset and services and to partner with RCTC to provide successful transitions to college and build a system of academic, social, and financial supports for adult learners.
Jawar, an immigrant from Pakistan, came to Hawthorne after leaving an arranged marriage to an American. She was determined to support herself and continue her education. At Hawthorne, she prepared for a healthcare career, became employed as a certified nursing assistant, continued on in Hawthorne in remedial coursework, which is about 70% of the students that come to RCTC need some level of remedial coursework. So she did her remedial coursework at Hawthorne rather than at the college. She successfully completed freshman comp, and that's our sort of our barrier to many students being successful in college, where that provides an opportunity for team teaching, where Hawthorne faculty teach with our faculty. They develop some co-curricular to make that transition successful. Jawar was nominated and awarded a Beat the Odds $2,500 scholarship to pursue the program at the college.
Abdi Kadir's story demonstrates the advocacy of our navigators and the dynamic partnership with Mayo Clinic. Abdi was a phlebotomist in Somalia before moving to the U.S. To support himself and his mother, he worked in customer service. Although employed, Abdi's goal was to rejoin the healthcare field and to work at Mayo Clinic. Abdi Kadir enrolled in prep classes for phlebotomy at Hawthorne. When he applied to Mayo School of Health Sciences phlebotomy program in January, Abdi was not offered an interview. Because of his international transcripts had not been received, his application was incomplete. The Bridges to Healthcare navigators advocated for Abdi. They worked with him to document his requests for transcripts and to include reference letters with his application. When he reapplied, his application was complete. During his interview with Mayo, something unprecedented occurred. Due to the credibility of the Hawthorne program, the admissions committee offered him a seat in the phlebotomy training program on the spot. He also received a full Mayo scholarship, as all Hawthorne Bridges to Healthcare participants do. When his Mayo teacher saw his phlebotomy skills, Abdi was offered the option to end his training and begin a paid position immediately. Although it was a tempting offer, he felt he could better serve Mayo patients if he completed the entire phlebotomy program. He graduates from Mayo May 22nd.
Yay.
And finally, Susan's story demonstrates the drive and the dignity of our adult learners. Though Susan was born and raised in the U.S., she was in other ways an immigrant. With German as her first language, she spoke limited English and had only 8 years of education. She came from a culture and a lifestyle out of mainstream America. Susan left her Amish community and family at age 18 to pursue her passion of an education. She came to Hawthorne and within 2 years earned her GED and took the Certified Nursing Assistant program. She became employed, but that wasn't enough for Susan. She wanted more. She returned back to Hawthorne for the remedial preparation so that she could attend RCTC and pursue her career in nursing. She sat across when she first decided to leave her family, working in an office building across from Mayo, and said to herself, one day I'm going to work at Mayo. And we expect, as she's done with her preparation this summer, that she will be offered an employment at Mayo.
Just a quick conclusion. On Thursday, we received the news that one of our Bridges to Healthcare participants was graduating from RCTC with honors in nursing. In 2011, Valerie, a refugee from Cameroon, entered Hawthorne's English language classes, progressing to the CNA, to college prep, and on to RCTC to become our first registered nurse.
Thank you so much. Those were very inspiring stories, and it's always good to hear. Thank you so much. You did go over your time, so we don't get as many moments to ask you questions, but they were great stories, so thank you, and it was really good to hear from you. Skip, did you have a question?
I did. I'd be curious to hear how important it is to have an anchor employer involved. We heard a lot about Mayo, and obviously they're an iconic institution, and you have a very, very low unemployment rate, so you have kind of a unique job environment there. How important is it as we think about replication to have that anchor employer so deeply engaged?
Well, certainly it's been a huge advantage for us, but you have to understand that Rochester is a very small city, the smallest city represented here with 110,000 people. But Mayo employs 34,000 people in its Rochester office, or its Rochester campus. So to have them as an anchor, they are the anchor for the entire community. Without their support, nothing really innovative happens in Rochester, frankly. That being said, healthcare, well, there's healthcare everywhere in this country. And healthcare employers need primary care healthcare workers. We need them. We baby boomers need them, and they need them. So, yes, anchors can be strong, but we started out without Mayo as an anchor. They were just a partner. In the last couple of years, they have become a financial anchor for us by contributing and guaranteeing us over about $500,000 of funding.
And if I can just add, with the unemployment rate that we have, employers are being forced to come up with different ways of developing their own employees and recruiting talent. And so when we look at the replication or the ability to transfer the model that we've developed, again, healthcare is everywhere. And when some of the major players in that industry see what Mayo Clinic is doing and what they're achieving in developing a diverse workforce that is filling those highly demanded positions, I suspect they will be motivated to look at those best practices.
Yes, Linda.
The outcomes that you produced in terms of retention and completion were just remarkable. I don't know that I've ever seen anything in the employment field like it. And it seems like the figuring out how to get that remedial class done before entry into the program was, or as part of the program, shifting that earlier in the non-tuition bearing stage. And I don't think I really understand it, and so if you could just explain it in a way that would also help us to understand, is that something that could be replicated broadly?
Oh, that's a really good question. I'm happy to answer it.
Yeah.
Yes, we have flipped what is normally done. Normally in this country, students enter community colleges, and as with RCTC, 70% of them need at least one remedial course. And it is typical also, becoming more typical for adult basic education programs to go to the colleges, and the students enter college, and adult basic ed is there to support them while they're in remedial classes. We decided to do the opposite, to incentivize our students to stay in adult basic ed, to teach those classes the way we teach them, to teach them more intensively, to teach them with a goal of them mastering the material, not failing people. Sometimes they do fail, but they're not done. They're off, they don't have it on their record, and we just say, okay, next time, how is it going to be different? How can we help you
But
succeed?
this is part of the public schools.
Right, we're part of the public schools. We're part of the adult ed division.
Yeah, and
So let me just, to get this straight, you're the public schools.
Well,
You
I'd
are-
like to say I'm the whole public schools, but no,
No, but
just the adult ed division.
you're the adult ed, so if the public schools were teaching the students, we wouldn't have this issue, right, in the first place. If they were, so that's one issue.
That's one of them, but we also have to recognize that students enter
Okay,
the
so
system.
that's, okay, you don't want
Yeah.
to go there, I can
Yeah,
tell.
you know what I'm
Okay,
talking about.
so let's not go there. So let's just go to, you have adult students, and they have a choice. They can go to the public schools to get their GED, right?
With
That's
us.
what you're telling me? Or they can go to their community college.
They have to have a GED before they can come to the community college.
And you're saying what you changed was when they got their GED, you did a better job of preparing them for community college.
We kept them. We incentivized them to stay with us rather than going to college where they were eligible to go. But we learned, and they have now it's sifted through the entire community, that you're better off staying at Hawthorne and getting ready before you go to college.
And can you, okay, so the question is, so what you're saying is that when the GED certificate as currently developed isn't really a good certificate because it allows people to go to community college when they're not really eligible, when they shouldn't go.
Right.
There should be something more thank you, more demanding if they want to go to community college because it's a way, they drop out of the community college and they feel badly about themselves and it goes on their record. So basically what you're saying is your innovation is making sure that the GED that they get is a much higher level.
It's taking them beyond the GED. Actually, the new GED is much more rigorous.
Right.
And we're seeing higher levels. That being said, we have people graduating from high schools all over this country without the skills to succeed in college, or 70%
Yes,
of
I
the...
remember I went there, but you didn't want to go there.
Yeah, I know, but they're going there. They're going to college.
I meant, I said,
Yeah, so it's like a GED plus, and so the standard, and so instead of doing the college readiness work in their first semester of college, which frustrates them and they drop out, you add it on top of the GED before they get there, and anyone who goes in with this, that's where you have like the 93% success rate or
Right,
something crazy
right.
like that. Yeah.
You're
So,
absolutely correct.
New York City, are you doing this?
So
it is-
I will tell you, just
Thank
to
you.
add to that, the refugee population that we're serving are coming, and they have diplomas from their home country, and we recognize those, but they don't have the English skills, and then they don't have the reading and writing skills that they need to be successful in college. They come to us, and we'll offer the
But they're-
classes.
And if they go to the GED, is the point is that that's free?
Mhm.
I have to say, that was a little hard for me to understand that, all of what you were saying. There was so much information. So this has been much clearer to me, and I thank you for that.
Good.
So most of the communities represented in this room don't have a Mayo, right? 40,000 employees and 110,000 residents, so it's a company town. Is it going to work without a Mayo? Is it going to work in Flint, Michigan, or Quincy, Massachusetts?
If you are a community that has health care, provides health, and has a healthcare system, of course, Mayo's in 6 states. And so that does help, that Mayo is all located in 6 different states now. But if you're a community that has a healthcare system, you probably need certified nursing assistants, you need phlebotomists, you need hemodialysis techs. What you need, and you also have people who are living at or below the poverty level, underemployed, undereducated, immigrant, refugee, whatever. You bring them together and provide a system for success for them and success for your community.
Good
You're
answer.
also customizing with the employer the community college piece as well. To what degree is Mayo involved in the community college?
So they certainly participated in our curriculum development process. And I see the time is up, but they developed, and they allowed us our faculty job shadow to make sure that when we were teaching them on the job or teaching them in the classroom, we were applying it to how they were going to experience it when they were on the job to make, again, that transition more smooth. But I think to your point with Mayo Clinic, Mayo Clinic has so believed in this program that they have gotten other departments who are hiring. So we started with one department that was doing hiring. Other departments have recognized, wow, you figured out how to recruit diverse, qualified folks. How do we get in at this? So we've sort of grown into, vertically integrated, but I will tell you also that Mayo has gone with us on our presentations to convince other employers in the healthcare industry to figure out how to do this, and that they will help consult and work with their HR departments to solve that.
Nice.
Thank you. That was
Thank you so
really
much.
interesting and really important. Actually, we had a long discussion at our lunch about how if we had the resources, we would try to take your program and replicate it across the country. Or we thought the federal government should do it, which went over really well. Thank you very much.